Hey, I'm Dr. Joffrey, and today we're going to discuss the top 7 reasons why your PSA may be elevated. The top 7 reasons why your PSA, also known as the prostate specific antigen, may be elevated. Well, first, a PSA, it's a protein that's produced by your prostate. Again, it's a protein that's produced by your prostate. The main purpose of this PSA is to help liquefy the sperm. That's the main purpose. It is normal to have small amounts, very small amounts of PSA in your blood. Very small amounts. You will see this when you have a healthy PSA. There'll be a slight leakage, which is why a normal range for a PSA in blood for men is a 1 to 4. Again, it's a 1 to 4. Now, some of you will ask, well, where's the prostate located? The prostate is located. It's just before your rectum on the inside, and just before your urethra. Can you reach down and touch it in your body? No, you're not able to. Now your doctor or your healthcare provider can take their finger and go through your rectum and feel your prostate. But in terms of being able to normally feel it, no. Who has a prostate? Only men who were born men have a prostate. Only men who were born men have a prostate. Now, I said it's normal for it to get into the blood, for the PSA to get into the blood. Yes. One is the natural shedding of your prostate, and that causes some of the PSA to leak into the blood. 2, there's a disruption of the prostate barrier. There's a disruption of the prostate barrier, also known as the architecture of the prostate. Things like inflammation can cause this, as well as manipulation of the prostate. In other words, if you have a PSA, if you have someone check your prostate and they rub it, that can cause spillage into the blood. Now, let's get into the top 7 reasons why you may have an elevated PSA. Number 1 is called benign prostatic hyperplasia. In other words, your prostate is enlarged for benign reasons, non-cancerous reasons. It often happens when males get older, and as a result of having a larger prostate, you've got more PSA appearing in your blood. Number 2, prostatitis. It can be an inflammation of your prostate or an infection of your prostate. That architecture is disrupted, so it can cause an increase in your PSA in your blood. And then I've already mentioned this one. 3, manipulation. So if someone massages that prostate, it can cause a falsely elevated PSA. Well, it's not falsely elevated. It is elevated. It's just not the result of cancer. Then 4, a urinary tract infection. That's right. A urinary tract infection can cause an increase in your PSA. Now, this happens, the 5th one happens as men get older. For many different reasons, as men get older, their PSA may slowly rise. So you at 18, your PSA may be 0.5. But as you get older, by the time you're 65, it may be 3.5. Don't forget, the normal range is from 0 to 4. And so getting older may cause your PSA to rise as well. And then number 6, ejaculation. So don't forget, the role of the prostate is to produce PSA, to help liquefy the sperm, to help it to be more fertile. So it can rise after ejaculation, but usually only stays elevated for about 48 hours. And then 7, this is the one that we're most concerned about, is your PSA rising as a result of cancer. Yes, your PSA increasing as a result of cancer. Let me land my plane and bring this home. In other words, if you get your PSA done and it's elevated, just so you know, there are 6 reasons that are non-cancerous why it is elevated. And between you and your doctor, you will tease out and work out, is this a significant rise that warrants further investigation? And I would say probably yes, but what that investigation looks like in terms of how you proceed will be decided between you and your doctor. In a later video, we will talk about some of the different options of how do you go about working up or investigating an elevated PSA. If you found this video, be sure to hit the subscribe button, share, or even leave a comment. Talk to you soon. I'll see you in the next video.